Hello, and welcome to Mast Labs Testing. My name is Dr. Scott Fawcett. I'm the Medical Director of Mast Labs Tests, and during this video I'm going to go over how to properly perform the COVID-19 nasopharyngeal swab test for PCR to detect whether or not you are actively infected with coronavirus. So first step, we need to make sure that we're in a clean environment. We're going to use this wipe to wash our hands. You can also use hand sanitizer or regular soap and water, which we have available. So we're going to wash our hands, do a really good job, get everywhere in the front, the thumbs, and then you're also going to want to make sure that you blow your nose so that we get any sort of mucus that may be in there and get a really good sample. Okay? So after we're in a clean environment, we're going to get our kit that you've been distributed. It's really important that you don't switch kits with anybody else. This is going to be your kit that you're going to use because once it's registered, it's going to be registered on your phone. That's going to be how you're going to get your results. So once you get this kit, make sure you keep it in your possession. Don't lose it. Don't get mixed up with anybody else's. Okay. So you're going to open up your kit. Right here is a barcode with a list of the code. You're going to use your phone. You've already downloaded the app. You're going to have to upload this testing code right here. It's going to start, you need both the alpha code and the numerical code that starts with LGC. Okay, so you're going to input that code into the app, and then you should be done. You're going to want to put the data collection and then your date of birth, as well as your gender right here. You do not need to put your name on or anything else. That's going to be connected to the app. Okay, so we'll go ahead and lift off this. This top cardboard portion. This just has some basic instructions. Inside will also be a collection kit instructions. It's a large form. You're welcome to open up and read that as well, okay? But we're basically going to go over all the things. This is the bag that if we're doing a single specimen return, this is where you're going to put your specimen into this bag. So just leave this to the side. You're going to have two swabs in here. There's the throat swab and the nasopharyngeal swab. Okay, so we need to make sure we can see those. Don't open them yet, okay? This is the testing medium kit. It's important we don't spill this. It should stand up just up right here. You'll also notice that it has that same code and same alpha code up here. You can go ahead and just double check that that's the same, but it should be. This is your card with your testing information on it. You're going to want to keep this on your possession. And then last is the biohazard sample bag. Leave this foam in here. That's just to protect the vial from breaking during transportation, okay? So we'll just set that aside, okay? So the first step, as we mentioned, we're gonna blow your nose. So that's been done. My nose is nice and clear. We're gonna go ahead and open this. Notice that the arrow is here. That's really important because the testing portion is down here. We don't want to touch that or contaminate it. So find the arrow right here on this nasopharyngeal swab. We're gonna do the nasopharyngeal stuff first, okay? You're going to take it out. You're going to want to have this open so that you can put this directly in there. Make sure it's in a safe position so that it doesn't get knocked over or anything like that. Okay? So you're going to go over here, and it's important to know that the nose doesn't go up and down. The nose goes front to back. Okay? So we're going to come to the side here, and you're just basically going to come right here underneath your nose and find your nostril and gently, you don't want to force it back, at about 30, 40 degrees, head it back right in the back of your nose. It shouldn't be uncomfortable, and it certainly shouldn't be painful. So you can see here I can talk while we're doing this. You're going to gently turn, leave it in there for 10 seconds, and then we're going to pull it out. This is going to go inside of the medium here, and you'll see that there's actually a little hash mark right here where we can break off this stick. Okay, you can dispose of the other end of the stick. Halfway done. All right. The next step we're going to do is we're going to get the throat swab. Okay. So the next step for that is we're going to open up again. This one doesn't have an arrow, or it sometimes may be obscured, but you just want to double check that this is where the cotton tip is. You don't want to open it on that side. Okay. So we'll find this little area right here. We're going to open this up. We'll take out the swab. You're going to want to be open up in the back. You can get as far back as you want. Don't gag yourself till you throw up or anything, but you want to get it back there so you can get the back. You want to avoid the tongue, okay? We'll put that in here. Again, the same little hash mark that we can break somewhere in here. So it's a little closer to the tip. There we go. That one's a little shorter, so they're different lengths there, okay? Once we're done here, we can basically close up the medium. That's done. You hand this to the lab technician. They will put it in the bag here like this, seal that up, and they'll put it in here, okay? Be sure that you get if you're just doing a single test, you may want to get a picture of this tracking ID so you can track a sample as it makes its way to the lab. So that concludes the testing. It's relatively simple. It's certainly painless. So once the specimen has arrived in the lab, you'll notice the lab has received it. You can see that progress on your app. It'll take about 12 to 36 hours for you to get the result. Once the result has come through, you'll get a notification on your app as well as a notification in your email that you registered with. You also receive CDC recommendations if you have a positive or negative test. If you are unfortunately positive, the chief medical officer will give you information as well as a follow-up nursing phone call to the phone number you registered with Let's Get Checked. They will go over proper isolation and treatment options. They'll probably recommend you follow up with your primary care doctor as well as notify the local authorities of the positive test. If you have any questions, please feel free to reach out to the testing technician prior to opening any materials, as if we get a contaminated test or something breaks, we'll have to purchase another test for you. And thank you again for using Mast Lab tests. We wish you a safe and healthy future.